Okay, good afternoon, everyone. Thank you for joining us today. My name is Carrie Stoltzfus. I'm the Executive Director here at Food and Friends. And I want to start by saying just how blown away I have been by everyone in our community and how you have responded to Food and Friends and everything that we're dealing with in this COVID-19 crisis. So I want to thank each and every one of you. Today, I'm going to provide a brief update on what we've been doing here at Food and Friends over the past week or two, and then we're going to turn to some questions that we've received and answer those as best we can. You do have the option to submit questions during this webinar using the Q&A function, and you can always send additional questions to Abigail Seiler, our Communications Director. Her contact information is in your confirmation email for this webinar. And if there are any questions that we can't get to today, we'll follow up with you individually. So with that, let me share some of the urgent activities that we've undertaken here at Food and Friends. We're part of the food supply chain in the Washington region, and we're also an organization that serves a vulnerable population, those who are living with serious illnesses. And because of those things, Food and Friends is considered an essential service by the District of Columbia. And that means that our operations will continue even as other businesses are shutting down. But as restrictions on non-essential movement continues to be tightened, and with different guidelines in DC, Maryland, and Virginia, we know that those restrictions are going to affect the trips that volunteers choose to take. And that's exactly as it should be. We all need to be making careful decisions right now. Over the past few weeks, Food and Friends has ordered about 50,000 pounds of non-perishable food in order to prepare a 2-week supply of food so that our clients could have what they needed if our normal deliveries were to be disrupted. Our goal was to use those when we got to a point when our normal delivery schedule became too difficult to maintain. So last Friday, we were seeing restrictions tighten throughout the region, and we decided that it was time to send those boxes out. So staff and volunteers rallied on Saturday to deliver over 2,000 boxes to our clients who receive our primary service, which we call home delivered meals. We also pre-delivered groceries to our groceries to go clients who are already on an every other week delivery schedule. It was a huge task. We required a lot of volunteer help to get it done. So I just want to take a moment to thank all of those volunteers who came in last Saturday to help us do that work. So that emergency delivery was important for 2 reasons. One, we ensured that all of our clients have a sufficient supply of food in case of any disruptions, and that was our #1 priority. And number 2, because each of our clients now does have a sufficient supply of food at home, we're taking this week to adjust our operations to allow for better social distancing, which I'll talk more about soon. And again, we've suspended volunteer activities for this week as we work on those changes. All of this comes down to the fact that we're an organization that is built to serve even in a crisis. For those of you who may not know our history, Food and Friends was founded at the height of the AIDS epidemic, which was another public health crisis. A small group of volunteers came together in a church basement to provide meals to people with AIDS who were seriously sick and often isolated from others. We were a lifeline to a vulnerable group, and we still see that as our role today. We face a very different crisis right now, but everyone should know that Food and Friends is still here and we are prepared for this. And it is your participation and your support that makes it possible for us to do that. So in regards to what happens next, if you volunteered recently, you've probably seen how challenging it has been to maintain proper social distancing in our kitchen. We want to protect our volunteers and our staff just as much as we do our clients. So we are developing thorough work plans for each area of our operation moving forward, each area of the kitchen. And some of those plans include we're making tight caps on the number of volunteers allowed in each work area and at each time of day. We are marking all of our work tables that we use for food production with 6-foot markers to show volunteers and staff where they should stand as they work. We're doing thorough training for all of our kitchen and delivery staff about social distancing, and we're adding additional signage throughout the building to remind people to space apart and spread out. So beginning next week, we are going to reopen to volunteers, but for delivery only next week. This is our highest need, and it's also a way for volunteers to assist us without having to be in close proximity to others. We are planning for kitchen and food packing volunteer shifts to resume in the following weeks, and we'll do that when we're ready with all of those work plans. And then moving forward, we're going to be delivering our home delivered meal program on a once-a-week basis. Historically, we've done that 3 times a week, but until this is behind us, we're going to be delivering once a week to each of those clients. All of our clients are going to continue to receive the same amount of food. We provide 18 medically tailored meals a week to each of our clients. And then again, our grocery clients will remain on their every other week schedule. I'm sure that there will be questions about these changes, and I'll return to those soon. But before that, though, I just want to share a bit about what our greatest needs are right now, and that remains financial support. So during the last several weeks, Food and Friends has already incurred additional expenses of over $100,000 to support our meal and delivery programs. The majority of those costs are attributed to the emergency food deliveries that we made over the weekend. So we bought over 50,000 pounds of food. We purchased over 2,000 boxes to put the food in, and we also brought in some of our contract kitchen and delivery staff to support our operations. In addition to increased expenses, our fundraising revenue is being affected by this crisis. You may not know that half of our operating budget is supported by philanthropy, including over $1 million from fundraising events that were scheduled between now and June. As we navigate this crisis, I hope we can count on you to join us by making a donation. Your gift of any amount will support our current operations, which now include both budgeted and unbudgeted expenses in order to provide meals and nutrition counseling for our clients. I know that these are tough times for all of us, and you're receiving many requests to donate. But if you're able to make a gift of any amount, you can do so online at foodandfriends.org. Every dollar helps, and every dollar is so appreciated. And if you are one of the hundreds of people who has already made a donation, or if you are with one of our foundation and corporate partners who has come through with emergency funding, we thank you, and I thank you. You and our amazing volunteers are what is keeping us going. So I hope some of your questions have already been answered, but I'm going to take some time now to answer a few of the questions that we have already received.
Carrie, what is being done differently so that volunteers can better socially distance?
So, like I've said, we're thinking a lot about distancing and spacing. We are capping the number of volunteers per shift. We're also, using more staff to help us complete those shifts, but capping the number of people that we're working with and being careful with those numbers. I also mentioned, we're marking table space and floor space so that everyone is seeing, has a visual of what 6 feet apart looks like and is working 6 feet apart. We're adjusting some of our shift times to spread volunteers out across time as well as space. And delivery volunteers next week, we are going to be bringing them in at intervals across time, and we're going to be giving them their food to deliver outside of our building under the red awning for those of you who are familiar with our grounds.
Okay, this next question is also from our emails. Is Food and Friends accepting new clients right now?
Yes, we are still seeing referrals come in from the medical providers that we partner with. We're seeing a slight rise in referrals right now. For example, a client with a caregiver who was preparing food for them, a couple months ago may not have been referred to Food and Friends, and today they are, because that caregiver is probably isolating in order to take care of their loved one. So we have seen an increase in clients. We are also working to accommodate our current clients who may be unable to get to their healthcare provider in order to recertify for our services. We obviously don't want anyone to lose access to us through any kind of paperwork problem. A lot of offices are delaying non-essential appointments, and so we're working with all of those clients to keep them on service as well. And that all means greater demand for our meals. And we're also hearing from a lot of people who don't have a medical need for Food and Friends, and our staff is working really hard to connect them to the other resources in our area that are addressing food needs for other populations.
Great. We have another email from someone interested in volunteering. Are there any age restrictions or other restrictions on who can volunteer right now?
Mm-hmm. So we've not decided to make an age restriction at this time. There are a number of groups who are considered to be at higher risk for complications from this virus. And if you're in one of those groups, we need you to make the decision that is best for you. If you're in a group that needs to stay home, that is how you can best support Food and Friends right now, is by staying home. Many of our volunteers have already made that difficult decision because they know that they're at higher risk, and we trust them in that decision. At this point, the best thing that we can do to reduce exposure and risk is to restrict the number of people in our building. That's why when we do open our kitchen, again, to volunteers, it will be at lower numbers. And if anyone suspects that they're sick or have been exposed to the virus, we need you to stay home. The symptoms of the virus are fever, cough, shortness of breath, and breathing difficulties. So if you have any of those symptoms, we need you to stay home. Again, city officials consider us to be an essential service. They know that we rely on volunteers, and therefore, until we're notified otherwise, volunteer activity with Food and Friends is also being considered essential.
Okay, Carrie, we have one follow-up from the Q&A on Zoom. Does everyone require a background check right now to volunteer?
We are still using our usual background check procedures. We have a lot of folks in our volunteer group who have already completed that, who have been with us, over the past months and years. We encourage you to sign up. We will be rescheduling the online sign up that we had to postpone last Saturday. So there will be future opportunities to volunteer at Food and Friends. Please do go to the website to do that, but we are still doing background checks on everyone who is helping us out.
And another question via email earlier in the week, will there be evening volunteer shifts opening up again soon? Some of our volunteers noted that volunteering can be hard during the day given child care and other responsibilities.
Mm-hmm. Yes, we will be bringing back evening shifts. We're not doing it this week since we're not using kitchen volunteers, but again, we want to space people over time as well as physically. And so we will be having those shifts again. The hours may be slightly differently. We might start at 5 instead of 6, for example, but we will be bringing that back.
I'm going to jump to a question more about volunteering that we've gotten some related questions via email and on the Q&A about safety. Mm-hmm. Will Food and Friends staff or volunteers be using masks or checking temperatures?
That's a good question. Let's start with masks. The CDC is not recommending that people in our line of work use masks, and it's important that we make them available, make sure the supply is available for frontline medical workers. Food and Friends is a support to the healthcare system, and hospitals refer clients to us. So we feel that it's particularly important to preserve masks for them at this time. If that changes, we'll act accordingly, but the guidance right now is to save the masks for the healthcare providers. In regards to checking temperatures, we are not going to be doing any medical screenings of any kind of staff or volunteers, such as taking the temperature of people before they enter the building. We're just not equipped to do that. And screenings like that by private employers, again, it's not recommended by the CDC. And some of those, laser thermometers that we've been seeing in photos and hearing about, they have the potential to be unreliable outside of a controlled health setting. So again, the best tool that we have is to limit the number of people that we have in the building, and that's what we're doing right now.
We have some related questions about safety during volunteering. Should delivery volunteers wear gloves when handling red bags or any other safety precautions?
Sure. So those of you who do deliveries for us will know what we refer to as red bags. It is a red insulated bag that we pack the meals in order to maintain proper temperature control throughout the delivery process. Since we're delivering once a week, we may not be using those. We're still figuring that out. But in regards to wearing gloves, you're welcome to wear gloves if you choose to bring them with you, but we won't be distributing the gloves that we use for our food preparation because that's what we need them for. We encourage people who are doing deliveries to wash your hands, sanitize your hands frequently between deliveries. And keep in mind that if you're wearing gloves, gloves will still spread the virus unless you're changing them frequently.
Is Food and Friends expanding their services to help other types of individuals in need?
That's a good question also. We're working really closely with a network of other providers that are providing food to other populations such as children, seniors, and the homeless. It's very important that we remain focused on serving people with a serious illness because we're the only ones equipped to do that. And, we do anticipate, a further increase in demand for that. But our staff, like I said, is working very hard to connect any of those requests to the appropriate resources to make sure that everyone's needs are met.
I'm going to ask a question about the clients that received those meal boxes. How are the clients who are elderly or sick able to prepare the foods that were delivered in those boxes?
So, our dietitians did a really good job in making the meal plans for those boxes to choose food items that were as easy to prepare as possible. So for example, there were some soups in there, some ready-to-eat items, as well as foods that were easy to cook. And we're also calling all of the clients who received the boxes to check in to make sure that they got them, to make sure that they're okay, and see how they're managing, and to let them know when their next delivery is scheduled.
I have a couple questions on the Q&A about becoming a delivery volunteer. One person asks if they don't have a car, can they still get signed up to assist a delivery volunteer? Or if they're a kitchen volunteer right now, but they haven't done deliveries, can they get cleared to become a delivery volunteer?
Yeah, definitely. If you've done kitchen work, just check it on the website or with the volunteer department if you've already got their contact info, and they can get you set up to do deliveries. And the first question was, if you don't have a car. Yeah, we've done that in the past. Just reach out. We might be able to match you up. It does make it easier sometimes to do it with two people. So again, just go to the website, sign up to volunteer, and we will get you set up.
Food and Friends is reducing food delivery from 3 times a week to 1 time a week. So we have a question: will this affect the amount of food that's being delivered?
It will not affect the amount of food that's being delivered. Clients will still get breakfast, lunch, and dinner, 18 meals a week. And we will be delivering more of that frozen than we have in the past, but they'll still get prepared food. All they have to do is heat it up, and they will get the same amount of food that they did before.
Carrie, you mentioned that we are working with other organizations to help people, get food that they need. We have one person who wrote in asking if you could share what some of those organizations are. Especially if they're doing other meal programs.
Sure. DC Central Kitchen is helping with some of the meals for kids right now who are out of school. Martha's Table and Miriam's Kitchen are doing homeless meals. We're also in regular contact with DCPS and the DC Office on Aging for the food programs that they are running.
So we've had a lot of volunteer-related questions, but if someone can't volunteer, how can they still be of help from home?
Yeah, that's a great question. I mentioned donations, and another thing that we are going to be putting out on social media soon is sending notes to staff. It's a tough time to be a frontline service provider right now. Our staff need a lot of encouragement. And we'd love to have you send in some notes of encouragement to keep them encouraged and keep them going. So please look out for more information about that on social media soon. Another thing that you can do is just, follow the guidelines, practice all the hygiene guidelines that you're hearing about in your own life, distance in your own life, be a good neighbor. And an additional thing that you can do is in the Senate bill that was passed last night, the COVID stimulus bill, the District of Columbia was classified as a territory and instead of as a state. So this is different from virtually any other federal funding bill, and that was an intentional distinction. What it means is DC stands to receive about $700 million fewer dollars in those stimulus funds than any of the states. Even though we have a population that's bigger than 2 states, we pay more in federal taxes per capita than any territory or state, and we have more cases of COVID than many states. So this will negatively impact our ability to recover from the crisis as a city, and it'll impact our ability to meet the needs of our clients during this trying time. So please call your senator or your representative and tell them that this is unacceptable. The people of DC need relief, just like people in any other part of the country. And in our metro region, we are all part of the same region, and what affects some of us affects all of us. So please do reach out to your representatives to ask that that be rectified.
Carrie, could you clarify just once more the timeline for the reopening of volunteer shifts?
Yes, so next week we will be open for delivery volunteers. Those signups are in Volunteer Hub, which if you're a Food and Friends volunteer, you can log in, you can sign up right now, and that is where we need you the most next week. Our plan is hopefully for the following week to start opening up kitchen and food packing shifts again. Again, we really want to make sure that we're ready to do that, but that is our goal. But for next week, please do sign up for delivery. We could really use your help.
I think we have covered most of the questions that we've received thus far, either directly or in other answers. We can take 1 minute just to see if anyone has any final questions. But of course, if you think of something after this, please reach out to us. Contact information is in your registration for this webinar, and we will be happy to follow up, answer more specific case-by-case questions. We do have one question about whether we accept PayPal for your donations, and that is something that actually will be rolling out in just the next couple of weeks, so keep a lookout for that on our donation forms.
Okay, so I think we've covered all of the questions that we have in the pipeline. But like I said at the beginning, please do reach out to us. We will answer any question individually for you that we weren't able to do through this format. And I just want to thank you again for spending some time with us this afternoon. Food and Friends is just so blessed with the best of our community in our area. And that's something that really shines through every day in good times, and it's especially meaningful to us right now. So thank you so much for being a part of the team and helping us do this important work. We're just so thankful.